My name is Ben Harriet and I'm with Harriet Chiropractic. This is video 2 in a 4-video series on passing the DOT commercial driver physical exam the first time, every time. This video is on the 2 most common reasons for failing the DOT commercial driver physical exam. When you pass your medical exam with no medical issues, you're provided a certification for 2 years. That's the maximum. If you pass the medical exam with a diagnosed medical condition that has the potential to get worse and impact the ability to drive safely within the span of a 2-year certification, you may receive a certification for less than 2 years. This varies by condition, but generally is dictated by the time period in which an initially acceptable presentation can progress to the point of threatening an unanticipated loss of consciousness event. In some cases, the driver might be referred to a treating doctor for assessment and treatment as appropriate. If the treating doctor is able to address the issue and provide the driver with the necessary documentation, the driver can still have his certificate completed within 45 days of the original exam. Now, this video is not about all the reasons why a person may not be fit to drive. Certainly blindness, deafness, epilepsy, and some other medical conditions can disqualify a driver, but as an examiner, I can tell you that most drivers don't have those conditions, and those are not the most common reasons why a driver does not ultimately get the certificate. Here are the 2 most common reasons. One is high blood pressure, and the second is the expiration of pending exam result. High blood pressure, or hypertension, is called the silent killer because it typically doesn't have symptoms that you would feel. But high blood pressure is known to be associated with strokes, heart attacks, and other sudden medical emergencies that occur without any warning whatsoever. A blood pressure has 2 numbers, a higher number over a lower number. They both count, and when either one exceeds normal, you have high blood pressure. The effect on your certification depends on how high and whether you're under medical treatment and supervision for that condition. In cases where the driver was not previously aware of a high blood pressure condition, typically we know that the condition came about since the last exam, and so it's typically not a huge threat. For this reason, the first time and the first time only instances of stage 1 high blood pressure are certified for a 1-year period. This gives the driver 1 year to make the necessary lifestyle changes or to otherwise get treatment necessary to present with a normal blood pressure a year later. Similarly, if a driver is under treatment for high blood pressure, the issue then is often just a matter of adjusting the treatment, and the driver is certified for 3 months to allow him time to see his doctor to get his treatment adjusted. In any other case where a driver presents with unmanaged high blood pressure, the driver will fail certification until he's obtained medical treatment and returns for a new exam once his blood pressure is under control. So, high blood pressure is the most common reason for failing his certification physical exam. This is why I've included video 4 dedicated to avoiding a false high blood pressure reading. The second most common reason for failing a certification is when a pending result expires. When a screening doctor refers a driver for evaluation by a treating doctor, the patient must return to resolve the pending certification within 45 days of the exam. The referral is documented within the reporting system for the FMCSA, so the deadline is not under the screening doctor's discretion. As long as the driver returns with the necessary documentation from the treating doctor, the exam findings and the documentation serve as the basis for certifying the driver. After 45 days, however, the exam findings for an incomplete pending result become invalid for certification purposes, and the FMCSA requires that the exam be repeated in its entirety to certify the driver. All right, so this is the end of video number 2 on the 2 most common reasons for failing a commercial driver DOT physical exam. To recap, the 2 most common reasons are that the driver has inadequately managed high blood pressure, or the driver failed to return within 45 days after being referred to another provider for evaluation and/or additional information. You're now ready to watch video 3, 4 key strategies for passing your DOT physical exam the first time, every time. When you're ready to schedule your exam, go to alliancedx.com where you can schedule an appointment that is less expensive than any other testing location in the area and is scheduled just for you so that there's no wait and you're in and out easy peasy. Thanks for watching. If you found this information helpful, please like it so that more people can find it if that's an option for you. I really appreciate your help.